Hey team, so today we're going to go over different lunge progressions that you can do for your strength training program, your rehab program, or any time that you're really looking to just start firing up the lower legs. The lunges themselves are great activities because they use a lot of your larger muscles. So the quads, the hamstrings, the adductors, all these muscles have a high amount of blood going to them. So by using them, it's going to burn the legs, but might also make you breathe hard. So let's go through these progressions. The first one is called a front lunge, and I'm going to show you at an angle here because what I want is for my pelvis to remain neutral. I want the foot on the right side here for the toe to remain forward. I don't want to go off to the side because that changes my base of support. Here, I'm more in a modified tandem position, and this is going to require a little bit of balance as well. So this is included as a front lunge because as you can see, I'm going from this position and then I'm leaning forward. So the knee is going near the toe. Some individuals will say that going past the toe will cause patellofemoral pain and will cause injuries overall, but there is some controversy to that, as always with everything, that if that truly causes training dysfunction or knee pain. For my individuals that I see in the rehab clinic, I do know that I prefer to stay behind the toe for already inflamed patellofemoral joint because it does reduce the contact forces from the patella into the femur, so the kneecap into the long bone here. So if you want to go just to the toe, that'd be fine. If you're an individual without any knee pain, you might be able to go further. Okay, so this is a front lunge. Second one we're going to do is a reverse lunge. A reverse lunge is just the opposite of that front lunge, that we're going to go backwards, try and keep the pelvis neutral, and then we go down. For those individuals that do have patellofemoral pain and knee pain, this might be a better alternative to the involved side so that you're not creating any new strain to the knee. Third one that we can do is a side lunge. There's two ways that you could do this. You can either lunge and keep this knee bent as you go, so it's kind of a modified partial lunge, or you could keep it straight, which puts all the strain on this side. So as you see, I'm stepping here over. This leg's going to go straight as I go down, and I can even go to my heel a little bit as I go down. Now, for an individual that has a lot of training to this leg, good strength, you could actually go all the way to the floor and back up. But for myself, we're not going to do that. So overall, the side lunge is another great adaptation to add a lot of strain or muscle building to this left leg or the right leg. So that's our third one. The fourth one that we're looking to do from the front lunge similarities is the drop lunge. So the front lunge, remember, we went with the knee over the toe. What we're going to do here is we're going to go straight down. So what I'm not looking to do is go forward. I still have the toe forward, and the pelvis neutral, and I'm just going to go straight down. Again, based on the depth, we'll increase the activity to this leg as well as this leg. So I'm actually working both. I'm working some quad on this side, I'm working some hamstring on this side. What you're going to find for individuals that have not done a lot of lunges is you're going to really fire up the hamstrings themselves, especially if any type of walking lunges, any type of repetitive lunges, you're going to really fire the hamstring. So the increased depth, the deeper you go, the more it's going to activate. So for a new beginner, someone that's just started training, focus on the partial squat. So again, the partial is where we just lightly go through the motion. We don't go all the way down to the ground. This is perfectly fine, perfectly good variation for you to use that will help with your training overall. And as you feel more comfortable, and the muscles will tell you when you can, start increasing your depth slowly. All right, team, 4 lunge progressions that you can do at home or in the training facility. All right, team, enjoyed today's lesson. Keep rising, keep learning, and I'll see you next time. Thanks for watching.